Okay. So I'm getting the number
Now,
for you.
is that particular CT scan with tracer?
Let me
I mean,
see,
not that I
believe
care,
so.
not that I care, but
Um,
I think that's what she said.
yes, with IV contrast. Yes.
Okay.
It helps us a lot of times when we're assessing like restaging. A lot of times we will use contrast because it helps with lymph node identification and everything to see where actually everything is looking. So, and usually we'll do it with contrast. Okay, so this time, any nausea?
Very little. I
Very
had
little.
less this week. The big thing I had this week is real loss of energy.
Okay.
I winded very easily,
Okay.
harder to breathe.
Okay.
And I talked to Dr. Cohen over at St. Lucie West, and she said, well, it's cancer. So, I mean, she didn't say it quite that way, but it's
And it's chemo.
yeah,
It's chemo.
it's going to happen. And she says it may get worse,
Okay.
but you're doing fine otherwise. I mean, so I just can't go out and do any little chores anymore.
Yeah.
It's
And that will get better
Yeah.
once you stop radiation and chemo. Sometimes it's not immediate though, so
weeks or months,
yes,
and I even read somewhere years.
sometimes it can be. It really is patient dependent, unfortunately. So, usually do I start to see patients start to feel a little bit better within 2 weeks? Yes, they start to kind of feel like they're on the mend. You may not be 100% better, but you can start to feel changes.
Well,
usually.
that's all I would ask for.
Mhm.
Yeah.
But remember, radiation works for about a month after, sometimes a month and a half. So, those effects are still there. Unfortunately, chemo is a little different. Chemo obviously comes out of your body a little bit faster. The side effects may be the same, though. A month, 2 months sometimes to go away. Did you have any of the acid reflux this time?
Very little, because I use the magic mouthwash, so
Okay.
that stuff really helps.
That does help. Okay, perfect. Here, she gave me the numbers, so let me write it down for you, just so that you have it. 77228.
Okay, so I should just wait for their call, and if I don't hear from them within 2 weeks, or maybe even a week.
Even a week, I would say, because
Yeah,
what
call.
you want it to be done. So, 1, 2. We want it the week of the November 12th.
Okay.
I'm gonna write.
They're pretty quick about getting in there, though.
Yeah, they are. The week of November 12th. Okay, there you go.
Thank you.
Perfect. And then what the good thing is as well is that once you have your CT scan, you'll see Dr. Mai like the week after. He'll kind of go over your CT, and then we'll go from there as far as what the next steps are for you. Obviously, I know we talked a little bit about immunotherapy before. We need that CT in order for them to even approve immunotherapy going forward. So kind of from that aspect, we get your CT, talk to Dr. Mai, he'll order the immunotherapy for you, and we'll get you started.
If they say theoretically or hypothetically,
Hypothetically.
not theoretically, hypothetically,
Everything's gone.
everything's gone,
Yeah.
they're not going to do the immunotherapy.
Now that depends. A lot of times it depends on what stage you were. Why that is because sometimes you worry about things still being kind of not there that you can physically see, but in your blood. What the immunotherapy does is make sure it stays that way.
Is there something that they're going to do that tells me if it, even though it's shrunk or
Yeah.
close to being gone,
Yeah.
that it hasn't spread somewhere else even in the
The
meantime?
CT scan.
That will do it.
tell us.
Okay.
Yeah. So your CT goes basically from right here all the way down to right here.
Okay.
So what it's going to tell me is that yes, we know it's here, but is there anything in the gallbladder or the liver or anywhere else that we would be concerned, or is there lymph nodes somewhere that we would be concerned about? So that's basically what that CT is going to do, and it's going to give Dr. Mai a little bit more information on that as well. So that's kind of like we do it in the beginning to see if there's any disease, and then we do it at the end to make sure there's none as
Right.
well. So really, this week coming up, your Thursday is your last treatment with us, and then Wednesday is your last radiation. So what we'll do is we'll see you on the 28th, just to make sure you're doing okay.
Next Tuesday.
I can push it to Thursday if you want.
No, I'd rather have the blood test.
Tuesday.
Tuesday.
Okay, so for Wednesday, yep. So we'll do Tuesday, and then we'll kind of just talk about how you did the last one. You'll have one more treatment after that as far as radiation, and then the next time you see us, you'll see Dr. Mai and talk about your scan.
Good.
Yeah, really good. And hopefully Dr. Cohen sends us everything so we can see what they were seeing.
I know. Well, I know she. Well, were you here when Dr. Cohen was, or Dr. Mai was right here?
No. I was.
Dr. Mai, before he went in with Jim, my next door neighbor actually.
Oh my God!
And,
Funny, small world.
Oh, I know. And he says, I've got some really good news for you. Sorry.
It's okay. No, it's great. It's good things.
He talked to the doctor this morning, so.
So that's good. That's great. That's good news. Those are happy tears. They should be.
Yeah.
Yeah. Happy things. Very good. You know, unfortunately, we don't see a ton of that. So.
That's what you're telling me.
So, you know, we just keep doing what we're doing. You par the rest of this 6 treatments.
Well, my doctor over there, Dr. Cohen, said, you need to go out and get a drink.
Yeah.
I said, you want to join me? She says, I can't. I go till 5.
Oh, bummer.
I said, I'm not going to do it anyways. I'm not a day drinker.
Yeah. You gotta wait till the next time.
I might just start a little early today. I mean, something I got. It's good news.
It is. It absolutely is. So you're on the home stretch. Okay. So just tough it out. A few more days. Obviously, if anything happens in between, none of it gets worse or anything, just give me a call. But for right now, I'll see you on Tuesday, and then I'll wait for Dr. Cohen's report and everything.
Do you think Dr. Mai wants to talk to me?
Let me see.
I know. I hate to have you interrupt him.
No. Let me just see. Let me ask him. No big deal. Give me 1 second, okay?
Okay, thanks.